To remain updated with the latest business news, click on the bell icon.
24 घंटे के अंदर हमारे देश में 2 ओमिक्रॉन वेरिएंट के केस हमारे इस नेटवर्क के द्वारा डिटेक्ट किए गए कर्नाटका में, जिसकी रिपोर्ट कल रात काफ़ी लेट आई थी, जिसको हम आपके सामने रखना चाहेंगे। और वह जो 2 केस हैं उनके बारे में हम बताना चाहेंगे कि उसमें से एक केस 66 साल के एक मेल हैं, दूसरा केस 46 साल के एक मेल हैं। और जैसे कि हमारा प्रोटोकॉल है, ना कि हमारे इंसाकॉग नेटवर्क ने उसको समय पर डिटेक्ट किया, बल्कि एज ए प्रोटोकॉल, एज ए प्रैक्टिस जो हमारी कॉन्टैक्ट ट्रेसिंग की पद्धति भी शुरू हुई है, और जितने उनके प्राइमरी कॉन्टैक्ट हैं और जितने सेकेंडरी कॉन्टैक्ट हैं उन सबको ट्रेस कर लिया गया है और उन सबकी टेस्टिंग करके उनको एज पर प्रोटोकॉल हम कोऑर्डिनेट कर रहे हैं।
First of all, we've already seen the Omicron variant now is a new threat. And what do we know about it today that we didn't know yesterday, because it's an evolving situation?
The thing that we worried about is the virulence of the infection. Is how virulent is this variant?
Right.
That means how sick will people get? So to answer your question, in perspective today, we are seeing from South Africa, where it was discovered, that it is spreading quite fast in that area of Botswana and bordering South Africa. And the numbers seem to be doubling almost every day.
Right.
That is the worrisome part about its infectivity. The second thing is that there is no clarity today about how severe the infection is. So the virulence is not established yet. Now, if you look at what happened in South Africa, they discovered this variant. They defined it as saying that there are 50 mutations on this virus. And the fact is that after having said that, there was a backlash from the rest of the world. The rest of the world rightfully reacted quite cautiously and quite violently to say, look, let's stop all travels from that part of the world because we don't want it to spread into our countries.
Yes.
And that has led to South Africa saying now that, look, we discovered it, we let the whole world know. We are letting you know that yes, it is spread, but its infectivity is very little. Now, so we don't know. The infectivity is high, but is the virulence is low. Okay, if that is the case, then we may suffer it, but then the severity of the disease may be less. Nevertheless, today, the way the world stands and the way India should stand, and I think the government has been very proactive, and which is very good, that we must protect our population, which is a large population. We do not want to suffer any more than what we did in the second wave. In fact, we've been working very hard to flatten the third wave by accelerating the vaccination. So in all possible, people who are double vaccinated, even if they get the infection from the Omicron, will suffer a very mild case. It will, so that's our hope. But if it spreads the way it is, and it even gives you mild infection, means that hundreds of thousands of people will get infected. So it's important that we control it right now, because if you get infected does not mean, if you don't have to go to the hospital, that you will be healthy. You will still suffer. The country will suffer. The whole workforce will suffer. The economy will suffer. So I think any measures taken today in prevention of this whole catastrophe is very, very welcome and essential.
If you like the video, do like, comment, share and subscribe.